the pledge, please. Pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So, has everybody went through the minutes? Can I get a motion approved?
Second.
All in favor?
Aye.
Opposed? Okay, Doc, you're up.
My turn? Okay, yes, we have two resolutions need your approval. And the first is we needed to increase money at the general fund for the Silk Road landfill. And as you know, this is our health department have been taking care of it for more than 10-15 years, and every year this site is still under federal government monitor, and every 5 years they came to check, and last one was scheduled last year, and they didn't come because of the COVID. And we still try to find out when they will come. And anyway, this project every year, yes, we needed to do some regular things. This table summarized very well, and every year almost, yes, the same cost. Almost, I should say. And every 5 years when it comes, and we increase some and be prepared, and after that, yes, we request some money for other they pointed out issues. So this to me is more like a routine.
Yeah, we have a reserve set up for Silk Road because it's a Superfund site, and then we periodically replenish that reserve as we use it. So what this does is take some money out of that reserve, put it into the capital project where they can expend it. The reserve is getting low, so I'll probably have a recommendation later this year to move some of our fund balance into that reserve. Generally, we do this every 3 to 5 years with an amount that gets us through the next 3 to 5 years. So, but that'll be another resolution. This one simply takes some money out of that reserve so that it can be used for what the EPA wants us to use it for.
Any questions?
Yeah, I do.
Go ahead.
Under EPA fees, I don't know who's supposed to answer this, Doc, you or Bill. Under cost, unknown estimate, unknown 10,000. What in God's name does that mean?
EPA fee means the federal government come here, and they will charge their travel, lodging, and set up equipment, collect the sample, and send it back to test. It's all on county's cost. This is not an unusual practice for federal government. And if federal government, even they call you, they can send a bill to you. I talk with you for 30 minutes, and this is the cost of my labor.
Like a lawyer.
Yeah, like a lawyer. And this is the way, yes, federal government deal with state and local government.
Sucks.
Yeah. And very, very costly because they came from New Jersey, and usually, yes, 2 people drove here, and in the early morning set up their equipment and collected some sample, and the second afternoon left. So all the mileage, everything, county picked up.
Tail water, hotel.
The good news is, over the so I've been with the county for 30 years. These costs have come down significantly from what they used to be. It used to be a couple $100,000 a year. But as that site settles down and less has to be done with it, you're spending this every 3 years now. So becoming less and less.
It just doesn't want to go white.
Oh, it never will go away. And the main matter is, it wasn't our dump. Now we own it, so it's,
Yeah, we inherited that. Any other questions? Motion,
Motion. Second.
second, all in favor,
Aye.
opposed? Once again, Doc, you-
Okay, the second resolution is just to move money for COVID-19 from one account to the other account. And the purpose of this move is for maximize federal funding. And I don't know the sequencing, honestly tell you. First the charge, Article 6 offers the charge FEMA. Anyway, the movement is just, yes, maximize the federal reimbursement for COVID-19 response. That's why we made this request.
have a motion,
So many.
second, questions? Good with it? Okay. All in favor, say aye.
Aye.
Opposed? Motion carries.
Okay, so my presentation. Okay, today we don't have a lot of slides. Okay, let me see. Here. Yes. Yeah, here.
Yep.
And oh, why you hide it for? Okay. Yeah, which one should I choose here? Yeah, and oh no, go too fast. I'm back.
Remember the late team.
Yeah.
Just
There's
sign them,
one more.
just sign them, don't question them.
There's one more, yep.
This, yes, I always show you this slide, and this is disease situation from the very beginning, March last year to as of last Sunday, and the 2 days ago here. And so you can see if this is the first wave and this is the second wave, third wave look like as we start the fourth wave at the beginning here. And at yesterday's this press release, weekly press release, I said, yeah, we saw weekly case counts increase, and from less than 10 cases a week. Last week was 52, and we saw it increase from about 10, about 20, and it jumped to about 50. And we still consider this is because Delta variant. And we don't have, honestly, I don't have data because state did not give us which county, what's the percentage of Delta variants or other virus strain percentage. But look at the whole situation in the nation and in the state, and we can reasonably say this is because of the Delta variant. Okay, and so this is some some challenge for us. And let me show you the next slides, and you can see, and our fully vaccinated still just above 50% of our total population, and this is the one-dose coverage. And you can see different color from 30% to 84%, and this in the county, and some area, yes, the vaccine coverage rate is low, and we're working on it. And last week Thursday, and we went to northern country and set up a clinic. It was very, very successful, and our team there 4 o'clock to 7:30, and vaccinated 66 people. And this I want to say probably over the last 2 years since we started larger scale, like hundreds of thousands of people clinic, this was one of the most successful. And legislators there did a lot of work, and well spread the words, and the people just come. And another thing, yes, we cannot ignore is really, yes, because Delta variant and more people they come to want to get the vaccine.
Is the state our only source for whether or not a positive is Delta variant or not? Or do we have other, can the doctors who diagnose it or the labs tell us whether it's a Delta variant or not?
No, you usually doctors clinic just diagnose to your COVID virus, and then they need to do a further step is sequencing virus DNA, and then can say. So state lab randomly collect the sample doing it, but they didn't share the number with us.
Do you know why they won't share the number?
Oh, I think a couple of reasons there, and one reason is their capacity, and yes, they are overwhelmed, and another reason is because their data they will consider will be biased because so many labs they doing the test, but not every lab doing sequencing, so they will always collect a small potentially biased sample.
Do we know if people who are hospitalized from our county have Delta or not?
No.
So we don't know.
We don't know, yes.
Do we know how many people are hospitalized from our county right now?
Yes. We reported it regularly, and in the past 3-4 months, and we had dozens of people hospitalized. Yes.
Do you know what the current number is?
I have only current number vaccinated. They hospitalized less than a handful. I cannot give the exact number, and I will touch it later.
All right, thanks.
All right.
Doc, do you have a sense of how many of the cases in general, though, are of the vaccinated population? So you have 52.
I will report it.
Okay.
Yeah, it's in my plan.
Okay.
And it's in my plan. So this is still vaccine is a big vaccination is a big job for us to do. And this is our team, and behind this is a new trailer, and Office for Emergency Preparedness, and their grant made this vehicle this trailer happen, and this picture took before it's made a voyage, and you can see we have 7 people actually. The photographer was not there, and 7 people first trip, and went out to plan to go throughout the county, visit every homeless shelter, and 7 people. And this is Dr. Pravano, and he's retired. He's a volunteer. The other 6 all county paid staff. And they went out, drove around throughout the county, vaccinated people. Sure, this is more than a month ago. Okay, and since this, we still very diligently promote the vaccine, and as I said, most recent one was very successful, and also we have our vaccine clinic walk-in every Wednesday, and for convenient for the people, we start at 1 o'clock until 5:30, 6 o'clock, and every Wednesday, and this was very successful in the last 2 Wednesdays, and one Wednesday, 50, both 52 probably.
So the 66 that got vaccinated, do you guys get a sense of, why they waited so long to get vaccinated? Was it they didn't know where to go, lack of accessibility to the vaccine? I mean, you had 66 show up, which is a great number, right?
Yeah.
So any sense of why they had waited months and decided to do it now?
Yes.
Just a change of heart? Tell us a little bit about that.
Some may change their heart, and we ask them,
Yeah.
and why you wait for this long? Because but some may change their mind, but they not explicitly say that. But many say it's convenient and you come. Really, we drove,
Creek, right?
Yeah, Sandy Creek. We went this far, and another reason is because we were the only county in the whole region, probably the whole state, almost the whole state. We still have J&J vaccine, and some people drove from Cortland, probably 2 hours or more, to the clinic. We asked why you come because everybody we need a collected address, and why you come here. Oh, I found you. You are the only place I can find the J&J. So 2 people from Portland, and some from Fairhaven, from Syracuse, for J&J. And yesterday we went to pick up more vaccine, and no more J&J at this point. J&J supply, yes, paused for more than several weeks. So and this picture is a Wednesday afternoon, our clinic, and you can see all this client space is full, and we have poster here, we have poster there, and it's always very, very busy. And next slides is interesting, and we put our signs here, and yes, get vaccinated, and this quickly another signage put here. So, but our staff still very very diligently promoted this vaccination. And let me finish this COVID-19 things, and then we can go. And I didn't make a lot of copy, and this is just a one email, and compliment our staff went to homebound population, and we give shots, and so far we give more than 150 homebound shots, and I know like plus urgent care, like Wayne drugs, they all participate, and we probably did 300 homebound population throughout the county. And
I'm looking at your chart up there, and it says 100% Minetto, but only 15% of people 23 to 34 have gotten the shot, but 73% of people less than 19 have gotten the shot.
yeah,
That number's accurate?
this number is accurate from the state website, and this is the last topic. This is the last topic. I reported this ELC grant, and I will every time bring here. And, sorry, I should not shoot it so early. Answer your question about our population, and so far we have 50% of our population fully vaccinated in the country. And our first, let me make things easy, and I didn't put into writing. And if somebody fully vaccinated and got tested positive, medically we call it a breakthrough case. A breakthrough case. So our first breakthrough case was in March. To the end of last month, and our county, we have 75 breakthrough cases. Okay, and totally from March to July, and we have 1,913 cases, positive cases. So I calculated, look at the vaccine effectiveness. We vaccinated 1,170 total population, 50%. So 75 divided by 50% of our total population. So the vaccinated, but they got tested positive percentage is 0.13%, less than 1%, even less than 99.5% they're positive. So vaccine is effective. And also I calculated, if you look at our another half, they didn't get vaccinated, or they're not fully vaccinated, and they had over 1,700 positive. So among them, they got a positive percentage is 2.8%. So this means vaccine protect the people and give people more than 21, 22 times more power to reduce the chance of getting vaccinated in the same community. Okay, and also, yes, I cannot release the number, I'm sorry, because usually less than 5, we not say how many. A handful, yes, they hospitalized from March to July. But all these cases, they all have underlying condition. And none of them, yes, die from COVID-19 because of vaccinated deaths. So on this side, really, I think you can understand that as more people vaccinated and the more chance vaccinated people become positive. And we saw the trend. If we look at the percentage-wise, every month, yes, we can see the trend. It's reasonable. More people get vaccinated, and the more people, the virus is still here, and we will get more positive. And this attributed to Delta virus for some reason, because Delta virus, we know, more infectious. And the second reason, this virus not only affect the vaccinated people, also they can duplicate in these vaccinated people. So vaccinated people become a carrier. So this is another reason, and that's why still I encourage people get vaccinated, and that's why we work so hard to promote the vaccine.
So I got a call from a couple that they got the Moderna 2 shots. She got flu-like symptoms, and he wanted to know, are we still doing free testing anywhere?
Free testing. All our sample, not all our testing kits expired, and we don't do testing, or we pause our collaboration with Plus Sky Urgent Care because supply issue. And on this side is we thought, yes, people, if positive and they can go to see a doctor and get tested at the doctor's office, because now testing is quite widely available.
I think their concern was the copay, that, they were able to get it done the first time, the testing, and then they went and got the vaccine. And then she came down with flu-like symptoms, and he says, wait a minute, I don't have the money to go pay somebody for this testing as a copay. And so how are we're not able to capture people that have that inhibition to say, look, I don't feel good, have I got it? And I'm symptomatic to it, that's why I feel this way. So those numbers aren't even in the system if people are not able to go get testing done.
I can go back and look at or work with state to see whether we can get more testing kids and bring here. But a bigger reason is really we don't want to waste taxpayers' dollars, and these testing kits and shelf life sometimes is very, very short. And I remember in May I refused some because only 1 month or 2 months. I said, no, we don't want it. I will take a look and if state can give us longer shelf life, and we can go back with plus die care and catch it.
Okay, I'm not even sure it's a widespread problem. I mean, it was a phone call that, as I said, well, go get tested. Like I said, they said no.
Look at our testing volume and our county testing volume over these weeks, and we saw steadily increase, and also percentage among testing positive increase. So our phone bank is still working, and we haven't heard this kind of request.
Okay.
Yeah, and phone bank still serve very well for the county for our operation, and phone bank like now, usually we can get 6 to 10 calls in a half day, and people different question and about disease activity, about their concern, positive, how to isolate, all these kind of things still serve us well. So if we want, I will bring back and share with my team and let them know, and we will make a judgmental call at some point to bring it back.
Yeah, it might just be an isolated incident.
It's
get the phone back, but I just wanted to bring it up because it was a call that they were concerned about.
It's not a big deal. The reason is because we have a contract there, and just I hope yes, state can be supportive, give us long shelf life testing kits. Because if I in May say yes, give me some, and probably yes, 10, 20 boxes will waste in our storage.
Thank you.
Thank you.
Just a quick follow-up with that. Do you have any sense of how effective the Abbott rapid test is that's being now sold in Walmart? So you can go pick this thing up for $20 off the shelf.
Don't quote me.
Okay. I was just curious because I'm like, okay, just kind of going back to, Jim's point,
What was that again?
Enough said. Thank you.
Yeah. And this I did an exercises with Dr. Lepke, and she gave me a paper, and so I really put the 2 nights home. I said, you give me homework, and I did it, and I returned her paperwork was Dr. Lepke. All the number I cannot put them together.
Good. Thank you.
So
Yes. Okay. Oh, Richard. Yeah, you're hiding in the corner. You blend in.
On the Spectrum or CBS, I can't remember which news station was, 2 days ago, released a regional report on, or they didn't release the whole report, but what they stated, or news commentator, we know the news is very reliable, mentioned the fact that Cincinnati and Cortland County and Parrish in Oswego County in the region were the lowest percent. You're aware of that. Help me understand why Parrish would be so low. I mean, we're not talking middle of nowhere here.
We were aware of it. We were aware of it. I don't know where the rumor came from, okay? And this was last Wednesday, and I forgot Channel 9 or Channel 3, Channel 5, and came to our clinic and they say, we want to interview you and we want to get to your situation. So I went there, talk with the reporter, the crew, and I said, you're welcome, and here is our operation today, our walking clinic, you're welcome. And I was told, you heard that Parrish was the lowest town in the state. I told her, I said, no, it's not true. And I said, I didn't say which zip code, but I said, we do have some area not as good as Parrish. And so after that, they didn't go to Parrish, and they stay in our clinic from like, yes, probably before 1 o'clock to 5:30, and did it twice live coverage.
You're a movie star.
I'm not a movie star. I wasn't on. And that afternoon I was there, and I put Diane and Dr. Ledke there, and I tried to get a bill. Honestly, thank you very much. Bill came, but they took a break, and they see. After that, I saw the report. I asked her, and so I hide, and I writing something, send it to the station, and because I stay here, and I write some and send it to them for their editing. So thank you, Phil, that you came. Thank you. So I was not the star, and the film missed the star opportunity. So this, but on this side, I look at the good side is really, because we heard the Parrish was low, we nudging Connects here. And the Connects here, yes, they're going to hold the events in Parrish. And this morning they are planning. And so we as a county is big, and we always work together. Yeah. So we heard the rumor, and we don't know where this came from, and we're working on it.
I was just surprised.
Yeah. Everybody in health department, we were surprised, and why you say this is the lowest. So this is the COVID-19 part, and let me report it to you. Second part, and other disease, and as you know, this is summertime and the mosquito. Oswego County can never miss a summer without a mosquito. and we started our mosquito surveillance, as I reported it to you previously, in early June, and we had some staffing issue, and we catched up, and now runs very smoothly, and until last week, and we got the first positive triple E mosquito in Albion. Yeah, and this is not a surprise because since I came here so many times, we had horses die from triple E there. But since I came here, this was the first time we caught positive mosquito there. And according to state entomologists, and this kind of specific mosquito can fly 10 to 15 miles further. So they think the mosquito originally still in the swampy area, but this very capable mosquito just flew this far and we caught it. So, and as a mosquito virus we also caught, and but it's not so significant. And before we announced mosquito positive, I think we had a general prevent mosquito-borne disease press release out, and some technical guidance. I'm going to get the Board of Health guidance this Friday. Okay, and another disease I wanted to let you know, but honestly will remain still anecdotal, is this year so many people, when I talk to local people, always say, oh, so many ticks, oh, so many ticks. I found the ticks on my dogs. I found the ticks many times, and I found the two when I walk shortly in the woods. This year probably, yes, ticks will be a big problem. And so we work as we can, and make education, and set up testing kits, and distribute in the community. Okay. So this is the second report, and the third report, yes, thank you very much. And last month at the legislators full meeting, you passed this ELC grant for school opening, and I said yes, because of this I will keep very sensitive and keep reporting to you. And this is my first time reporting to you two things. One is we worked with school district, and school district arranged to have a virtual call tomorrow, and we will talk with all school districts and see their acceptance. And so I have not much to report to you. And this is why I sent it to you, and you already saw. And because school, when we talk about this, school give us the first response was, we don't know our region, what's happening and how things going on, and we need more data. So I look at and this existing data, and we can share with them, and I send it to them more than a week. That's why the end date is July 23rd, and I just send it to them. And as an example, whether the school feel, yes, we use this zip code number and can meet their needs, and get their feedbacks. And if they say they can live with it, and we can I'm planning every week and give them this kind of format. If they say they cannot meet them their needs, this will be a little more challenging, and I need to go back and look at what we can provide to them. I know your attention, and now we can discuss it.
Well, going by zip code, Minetto doesn't deliver mail, so all the mail that goes to the 13115 is pickup at the post office. That's probably why you have 100%. There's only a certain amount of people that are affected by that. It's not. I live out in that region. We have a 13126 zip code, so that's probably skewed, but based on the post office. There's no delivery, so it's only people go there and they have a little box and they get their mail at 13135.
I agree. It will be skewed, because even if you look at the 73, and I forgot, somebody told me some cells very small, and their population only like less than 20.
Yeah.
So it's possible.
Yeah.
It's possible. I agree.
That's a good point.
Well, they don't deliver. So
Yeah.
if you get delivery, you got to be in 13126. So
I mean, you take the whole town of Grant, they don't have a zip code at all.
Right.
Certain towns like that.
Yeah.
so.
Right.
Yeah.
Right.
And-
Yeah, so how do they get a breakdown from Granby if they don't have a zip code? Do they have their own post office in Granby?
No, when everybody get their shots and they give address, and if just to get the address, even you put your address is Oswego zip code for your mail, but the state still use their system, can transfer all these into zip codes based on address, not based on zip codes.
I understand, but I think the point that I was trying to make is that you live in Minetto, you still have an Oswego address, with an Oswego zip code. So if you're getting mail in Minetto, you're only getting it at the post office.
No,
So nobody puts Minetto on their address
Yes.
unless they get their mail at the
Yes.
post office.
what I mean is, yes, if you put a Manado address with Oswego zip code, the GIS system still
Yeah, well, you
can
code it to the town.
can turn into this area zip codes. This is what I'm trying to say. Yeah, GIS system, and when we work at the beginning, and I remember last year March, and because we only not many cases, and we want to see where they are, and even we manually we can find out, oh, this is a zip code encoded, but people live in Granby, and this is the zip code in Oswego, but they live in Oswego Township, not in the city.
When you see 100%, it's got to raise an eyebrow to tell you that it can't be accurate.
100%, yes, like this, it's like a population small and skewed, it's possible.
Doc, real quick comment. Obviously, I voted against the grant funding that legislature passed, and now we have to kind of move forward. I think that my comment to you would be a couple-fold. One, a fellow legislator spoke to the board president for the Oswego City School District regarding this funding. Her concern, former legislator, as well, was the fact that the school wasn't consulted prior to the grant funding being considered and voted on by the legislature, because this is money directly for the school district. So she had that concern that perhaps we missed a step in terms of consulting the schools first before accepting the funding. So just a kind of a heads up to your conversation that you might get some pushback related to that. And number two, I think the connected concern is, what are the strings attached to that, to this funding, right? And the concerns that we've accepted the funding, what are the strings that are going to be attached to this? Some of it's in your wheelhouse, obviously, but as I pointed out, the legislature meeting, some of it goes well beyond the county Department of Health level in terms of the strings. So don't be surprised if, at least from this particular individual, and there may be others, that there's some skepticism with the funding, and I think it would do you well to kind of not only listen, but obviously have a game plan going forward to be able to answer some of those questions.
Okay. Thank you. So this is we shared, and also at the state level, and the state push very hard and want us submit our plan. So we submitted our plan, and most of the chunk of money put it into somewhere. Still, yes, we can maneuver with state and put into testing or into other needs. So it's still bigger room there. So this is my report to you about yes. Probably yes, next month at our meeting I will report to you about how the meeting is.
Any other questions? Okay, so I know, go ahead.
Yeah, Doc, I just want to make a comment. We're going to need your help because things are happening rapidly. What I mean by help, things are changing quickly with this new virus. I walked in before I came here. I happened to be on Route 31, which my property borders on the county, and I stopped at Walmart to get a birthday card. and that's neither here nor there. But the point is, when I walked into the place, they made me put a mask on. They were right there at the door. And when we get something like that coming in our county, we need a heads up, because I'm going to get questions on that when it comes. Central Square, as of yesterday, didn't, the Walmart. So it's coming down the pike. I can see it as clear as I can see Phil. It's coming down the pike. We need a heads up so we have some kind of answers when our constituents call.
Aye.
No, I think you were in the Walmart in Onondaga County.
Yeah, but it's just a matter of time for it to cross that river.
Yeah,
I mean, that's not
CDC put Onondaga on a classification where they want people to wear masks no matter what, because the transmission rate there is high. We're still moderate, but I agree, we could end up elevating as well.
Yeah.
We gotta make a decision whether we are gonna require that or just encourage it.
Well,
the way Onondaga did.
Follow up, how close are we, Chang? Do you know?
I want to say it could be very quick, because if you look at just a week, our county at the CDC website, our county's 7 days accumulated from 22 to 52. And if the number above 67, I think, yes, CDC will put us at significant. And yesterday I sent an email to Phil and the chairman, and I said, yes, we're monitoring it, and this is we needed to do something. And I agree with you. Just before the meeting, Dr. Newberg called me and said, yes, he said we needed to put the face mask on, and especially he concerned county jail. I said to him, yes, we noticed it, and if you look at yesterday's press release, and we just like previous week we put it there is unvaccinated put the face mask on. Yesterday we put it there. If you're immune, even if you're fully vaccinated, but you or your family member have immunocompromised or other condition, you have COVID infection concern, you may put your face mask on. And we'll change our tone to this level, and we're not wait. And I talked with Dr. Newberg. I say yes, for your jail specific concern, he can make decisions. Say, I want everybody to put the masks on. Don't need to wait till we say yes, everybody put the face masks on. I told the doctor.
Yeah. Well, the other concern that I've got is that there's a lot of misdirection right now, because I can't believe the leadership in this state said if you own a restaurant, you should be standing at the door and telling people if you don't have a vaccination, you can't come in. I mean, that's and I was at an Aldi store Sunday morning, and the place was swamped, and somebody had went on Facebook and said Aldi's was no longer going to be able to ship as much food to their stores. And I mean, they were lined 15 deep down the aisles. And the district supervisor was there saying, that's not true. I don't know who started this, but we're fine. But I mean, it was back into the panic buying. I mean, they were cleaning shelves off. There's just not a clear direction at all in a lot of this. I mean, I was floored when I heard that from the state that said, you know what, if you own a restaurant, here's the easiest solution. They can't prove vaccination, don't sit.
Well, it would appear that the state is obviously, their shift, whether Mr. Governor yesterday, was this notion that they're no longer going to be in the position of these sort of state requirements. They're going to leave it all to the local,
right,
the county and the local municipalities for this. So they've shifted the responsibility, if you will, away from the state. And I don't know if that's bad or good. It just seems to be that, from my perspective, the state's no longer willing to make the decisions that in fact they probably need to make. And I think partly it has to do with this sort of confusion coming from the CDC and the other parts of the state, so on and so forth, in terms of where to jump and how high to jump today. So I don't envy your position as a result of all this sort of back and forth, do we not, sort of thing, because it puts everybody in such a difficult situation to figure out kind of how to move forward.
Well, the thing is, we gotta keep in mind is we've got a building situation, it's an incubator, those kids are coming back to college. And they're from all over Hell's Creation. Plus, you got an event here pretty soon with Dirt Week, and those people are all over the place.
For college, we closely work with them, and
That doesn't matter.
Colleges they are coming and they already they say they're coming student 60% already vaccinated, and now we're working with them, and probably middle of August we will work with them, run a clinic to vaccinate their students.
They're requiring vaccinations. If you don't get vaccinated, you're succumbing to weekly testing, lack of, you can't participate in sports. I mean, there's some pretty distinct restrictions and testing requirements for unvaccinated students at the college level. So, versus a vaccinated student. I mean, my son, student class did the same thing. He's vaccinated, but the listing of requirements that they have to go through. Tested. Everybody gets tested as soon as they show up. Masking requirements for the first 2 weeks for everybody until they figure out kind of what the viral load is at the institution. I mean, the colleges, I think, actually probably done a pretty good job in figuring out how to manage the student population moving on in. So, might not be as crazy as it was last year when they were just trying to figure out how to manage everything.
So, last time we had the question come up over the traffic safety board, answer for the health department, and then someone said, well, we don't even know who's on it.
So here it is.
Now you have it.
I thought we were making the minutes.
And the other question we had was, what can they do? Research that and the law, yes, they can review accident data and make recommendations for traffic controls and traffic improvements in the roadways around the county. Traditionally, this advisory board has not done that. They've done things like safety programs for car seats and things like that, but they are empowered to do that type of work.
When was the last time they met?
I don't know, because the other thing I looked for was minutes from them.
Yeah, I think the COVID-19 and a lot of organizations.
Well, they were advisory councils were suspended by the chairman during.
Sure.
So, you know, if they didn't meet in 2020, it's not their fault. Yeah, look at 19.
We're 3 quarters through 2021 now.
Right, so they should have better.
Things gotta get rolling again, right?
Yes.
Before we shut down, we gotta get rolling.
At least get 1 or 2 meetings.
October of 2019 was the last.
Nick, need the appropriate motion?
Motion adjourned.
Second? Favor?
Aye.